So what are the risks of these diets? And really, what is the goal for a young person for healthy eating? So hello and welcome to Cocoa Pods, a podcast of the Birth Center for Natural Deliveries Foundation. Today, we're fortunate to have with us Dr. Sesi Dosunmu Ogunbi. She's a pediatric gastroenterologist, that is a pediatric GI specialist. So what are the risks of these diets? And really, what is the goal for a young person for healthy eating?
Okay. All right. Well, of course, there's concerns about all this diets, this fat diet. We said that we have the restricted diet, the forbidden group, and the social media diet. So the concern for the restricted diet that you have difficulty meeting your macro and micronutrients. The macronutrients are your fat, your carbohydrate, your protein, and the micronutrients are your vitamins and minerals in your body. So if you're not able to meet all your daily needs for this. Some of this diet are just dangerous for some health condition. For example, diabetes. If you're on this restricted diet, you're fasting for this long, and you're on insulin, that can affect your health. And there's some medications that people are taking, like you have to take with food, like there's some antidepressants and iron that you have to take with food. And if you're on this fasting, you're not able to take it, and you take it on an empty stomach, it can affect your body as well. And there's no studies that have shown that this diet are more effective than scheduled eating. In the forbidden group, there's a risk for nutrient deficiency because you're so restricted with your diet. Those who are on a no dairy diet, they can affect their calcium and vitamin D and other things that you can also have from restricted diet. You can have your vitamin B12, zinc, fiber, magnesium deficiency from this, and it's not sustainable. Again, can you imagine having patient here who has been on this watermelon diet? You can imagine her being invited to her friends, to a restaurant to go and eat, but because she's on a diet, on this watermelon diet, she's very anxious. She creates an anxiety. She can't go, and then she self-isolates herself. She can interact, with her friends because she's on this diet. So it just creates a lot of anxiety, and we don't know what the long-term consequences of this forbidden food can do. Then, of course, the social media. A lot of these celebrities are posting on social media. Quite a number of them may have eating disorders, but of course, our young people are trying to copy their habits. And that can lead also to their own eating disorder. And then this trend is just so extreme and it's harmful to their health. And again, you have some of this, like this high diet that have lemon coffee that has a high concentration of caffeine that's even beyond what is recommended, or even not recommended, but just too high, that can affect heart problems, can cause heart problems. So in anything, in any diet, the goal of healthy eating is that you need to eat a complete nutrition. That's what we tell our children. You have to have a complete nutrition. And in fact, some of them may need to take a supplement, just to make sure you have a balanced diet. You have to have that healthy relationship with food. Is not your enemy. You just have to have that healthy relationship. You don't need to let it consume you, as if, well, I can't eat this, I can't eat that. So you don't let it take over your life. And then, you want a diet that is a sustainable eating habit. It doesn't mean you want to eat all food. You don't want to demonize any food. That doesn't mean you should go around eating cake and dessert all day, but, you just want to eat all food, but, in the right amount.
Wow. Thank you so much for that. As we're talking about diets, there are conditions associated with lifestyle factors like obesity, poor diet, sedentary behavior, and metabolic conditions like you talked about, such as diabetes and insulin resistance. There is a condition that can lead to accumulation of fat, specifically in liver cells. So, Dr. O, first of all, what is the liver? What does it do? And what is that condition in which fat abnormally accumulates in the liver?
Right. So What's the liver? So liver is it's an organ in our body and actually in our abdomen that helps us process the food that we eat. It removes waste and toxins from the blood, and it helps make proteins and hormones that the body needs to function. So it's a very, very important organ in our body. So fatty liver, which the medical term we use is non-alcoholic fatty liver disease, although they're trying to change the name to metabolic associated fatty liver disease. So they call it non-alcoholic because it's the same type of liver condition you see in someone that drinks alcohol. It's pretty much what it is. It's the same liver disorder, but in this case, this patient is not drinking alcohol, and so it's a problem, again, caused by just too much fat in the liver. So this can happen in children as well that don't even drink alcohol. We have fatty liver. It could be mild or severe. And some people with fatty liver have more severe form that includes damage. They have inflammation inside their liver. And this is called non-alcoholic steatohepatitis. In short, we say NASH, NASH. And then over time, NASH can cause scar tissue and develop in the liver. And eventually this scar tissue replace all the healthy cells and the liver cannot work anymore. And this condition is cirrhosis of the liver.
Wow. Thank you for those answers. So how is fatty liver diagnosed? And, can you maybe tell us again some of the things that cause fatty liver, just in layman's terms, so that we can really understand this problem?
Okay, so fatty liver is usually suspected in someone who is overweight, with a body mass, very high body mass index. If your doctor suspects fatty liver, they will send some blood tests to check your liver function. And if the patient with fatty liver, a blood test will frequently show whether there's an elevated protein called ALT, this alanine aminotransferase. These results suggest that liver inflammation, that there's some inflammation in your liver. Sometimes your doctor will also perform an abdominal ultrasound, which can show that there's too much fat in your liver. There's other conditions that can cause, that conditions such as viral hepatitis, autoimmune hepatitis, metabolic disease that can also cause fat accumulation in the liver. So your doctor may also want to exclude those conditions as well. Once the fatty liver is confirmed, there are other tests that can be used to measure how severe how severe your fatty liver is. They may do an MRI or image, that's a magnetic resonance imaging scan that can help measure how much fat is in your liver and can look for scar tissue, fibrosis. And there are other tests like the FibroScan. And then, of course, sometimes you have to even do a liver biopsy to measure not just the inflammation, but also the scar tissue in the liver.
Wow. Thank you. Pregnancy itself can sometimes lead to a condition called gestational fatty liver, which is rare, but a serious complication. It is most commonly associated with severe preeclampsia and a condition called HELLP syndrome, both of which are serious pregnancy-related conditions. Gestational, that is pregnancy fatty liver, can cause liver dysfunction and potentially lead to acute liver failure, posing risks to both the mother and the fetus. So if an adolescent girl with pre-existing fatty liver, suspected because she was very overweight, like you said, becomes pregnant, her risk of complications may be elevated due to the underlying liver condition. Moreover, if an adolescent develops gestational fatty liver during pregnancy, the presence of a pre-existing fatty liver might make the situation worse. Adolescents, especially those with risk factors for fatty liver like obesity, we tell them to be mindful of their liver health through a balanced diet and regular physical activity. Pregnant adolescents should receive proper prenatal care to monitor and manage any potential complications, especially if they have pre-existing liver conditions. So, Dr. O, we consult with healthcare professionals like yourself for the most up-to-date and accurate information on these matters. How is fatty liver treated generally after a diagnosis has been made?
Yes, the first treatment of fatty liver is trying to change your diet by reducing added sugar. The biggest cause of is the added sugar. So this includes limiting things like sugar sweetened beverages, sugary food like cakes and dessert, and all juices. A lot of these juices have a lot of added sugar to them. The American Heart Association recommends 25 grams or less per day of added sugar. And those with fatty liver actually need less than that, of this added sugar. So, you may work with your dietitian or on reading labels, because there's some food that have natural sugar. It's the added sugar that is the biggest concern, not just the sugar. So when you're looking at a label, on any food packages, it'll tell you it has, this percentage of added sugar in it. So obviously you want to go with the one with the very lowest. As I said, you want to limit it to no more than 25 grams of added sugar in a day. In addition to changing the diet, increasing your exercise may promote weight loss and reduce fatty liver. It can be helpful to increase daily activity like playing sports, if your kids playing in the background in the parks, going for a walk with your friends and your spouse, and other activities. Currently, recommendation is about 30 to 60 minutes of activity per day. And those with fatty liver may even need more to increase their activities more than that. Because fatty liver does not always improve with better health, diet, and exercise, there's some fatty liver that is treated with medication. And researchers have shown that there's some medication out there that are now using to treat fatty liver, especially where there's inflammation and scar tissue.
Wow. So we start with behavioral changes, making sure we maintain a healthy weight, and just watching what we eat. And then there are some medications that can be used to, I guess, reverse the process of scarring. Is that possible?
Yes. Like I said, the first step is that lifestyle change. It's a lifestyle change, changing again, like I said, the biggest cause is the added sugar. Most of them say fatty liver, but it's sugar that gets converted to the fat. So reducing the number of sugar, and then just being active, moving. It's a part of trying to maintain a healthy weight. And then also, like I said, for those who have tried those lifestyle changes and it's not working for them, and there are some medications out there that is being used. Actually, for both children and adults, but obviously you have to consult with your doctors for that.
Well, thank you. So we delve into a vital topic of bleeding, and not from the area we GYN doctors usually concentrate on, but from the lower gastrointestinal tract. So the lower gastrointestinal tract ends with the rectum. So we want to look into lower GI bleeding in young individuals, and lower gastrointestinal bleeding in young individuals and pregnant persons can have unique challenges, underlying causes, and management strategies in these dynamic stages of life. From the impact of lifestyle factors on young people to the intriguing complexities of pregnancy-related changes, we want to unravel the connections between these experiences and lower GI bleeding. So let's embark on a journey of understanding and insight into this often overlooked aspect of health. So, Dr. O, what is lower gastrointestinal bleeding, and what signs and symptoms should the person look for to tell them that they're having bleeding from their lower GI tract?
Okay. So first of all, the gastrointestinal system consists of the GI tract and the GI glands. The GI tract is essentially a tube that processes the food and liquids that we eat or ingest. The GI tract is divided into different parts, beginning with the mouth, followed by the esophagus, which is the food pipe, the stomach, the small intestine, which we call the small bowel, and then the large intestine, which we call the colon or the large bowel, and then ending in the anus. The lower GI tract includes the second and third portion of the small intestine, which we call the jejunum and the ileum, and then as well as the large intestine. So any irritation or ulcers of the lining of the lower GI tract can cause lower GI bleeding. So what are the signs and symptoms of lower GI bleeding? The signs would depend on the location and the quantity of the bleeding. It can be either obvious or it could be hidden. So if the bleeding is obvious, meaning that you can actually see the blood, you can see bright red blood from the anus. Bleeding could be just streaks of blood, or you can pass large clots, and it can be mixed in with the stool, or it can just be just right outside, just coating the stool. If the bleeding starts further in the lower GI tract, you may see just this black, sticky, tarry stools, which we call melena, and which can sometimes look like tar, and it could be foul smelling. If bleeding is hidden, it may have symptoms such as belly pain, lightheadedness and fainting, chest discomfort, nausea, difficulty breathing. So your doctor may want to do a special test on your stool to detect if there's this, looking for this hidden blood. The consistency of the stool, including constipation or diarrhea, can also be an important indicator of the cause of your lower GI bleeding. So some important symptoms to discuss with your doctor are how often you go into the bathroom, whether you're having abdominal pain with with this bleeding, or whether you're having accidents with stooling, you're having waking up in the night to go to the bathroom, whether you have fever or if you have weight loss. And those are the questions your doctor will ask you, if you present with them with lower GI bleeding.
So mainly look at your stool.
Yes, look at your stool. Yes, look at it. There's yes, we GI doctor, we talk about, so when it's always interesting when I talk to my teenage kids and I start telling them to describe their stool, because I ask this question so many times and they kind of look at me. It's like, why is she asking me all this about the stool? So there's so much information you can get from your stool, from the consistency to whether it's hard or loose. In fact, we have a Bristol chart where it tells you the different consistency of your stool. It even described it in full, like sausage. All that is different things. It tells you whether you have blood in it. Just all things. There's a lot of information you can get from your stool.
So look at this tool, and if you're so what is the summary symptom? In summary, what do you want to tell somebody with lower GI bleeding? Mm-hmm. In summary, what kind of symptoms would they have?
Well, like I said, it's obviously if it's obvious, and
so obvious blood.
Obviously, could have obvious blood, and it could be hidden. The obvious one, you'll see blood. It's not normal to see blood in your stool. So if you see blood in your stool, it's abnormal. So the question is, what are the other things that goes along with this blood? Are you constipated? Which we'll talk a little bit more about that. I'm sure you're going to ask me some questions about that later.
Yeah.
On.
So what causes lower gastrointestinal bleeding? Well, yeah. And how is it diagnosed? What causes it?
Okay. So lower GI bleeding is a symptom of an underlying problem in the lower GI tract, and which could vary with age. So what you expect a cause you see in a adolescence could be different from a middle age or from an adult, maybe a geriatric patient. So it can vary with age. It could be as simple, well, I'm not going to say simple, not simple to the patient, but it could be just a cut, like we call anal fissure, or hemorrhoids that can be caused by constipation from straining. When you strain, it can cause a break, and of course the hemorrhoids are just like dilated blood vessels, that from the straining. You could have a growth in the lining of the colon, which could include just polyps, and polyps could be, some of them could be cancerous, like in colon cancer. It could be, you could see blood from infection, like virus or parasite or bacteria infection. There's inflammatory bowel disease, Crohn's and ulcerative colitis can cause bleeding. In some, young people, Meckel's diverticulum, which is an abnormal pouch in the lower part of the small intestine that is present in birth. Even though most people say that usually you see that in young children, they said there's less than 2 years of age, but I've seen it at any age. I've seen it in older, people, so it can present at any age. So it shouldn't just not children alone you can have that, and it can cause a lot of bleeding.
So it's called Meckel's
diverticulum.
So yes. Just named after somebody.
Yes.
And it can be present it's present at birth.
It's present at birth. So it's basically, it's like a pocket, a pouch, right in the lower intestine, and that pouch is lined by a different lining of tissue, and that tissue can bleed. And so they say it presents like painless rectal bleeding. So, and some of them can bleed a lot from that, you know. So again, like I said, most of the time it presents in very young children. That's the most common age, but you can present at any age. So it's not something that we always, just say because the person is 25, you're not going to completely exclude that from your diagnosis, so especially if you can't find anything else causing their bleeding.
And now, is there a stool of a particular characteristic? Is there a way you describe this stool of somebody with Meckel's diverticulum? Is it jelly-like or?
No, they just present with just a lot of blood. They call it rectal bleeding. It's not without, they just bleed without, there's no stool involved. They just see that they just come in. Some of them may have clots and usually bright red blood. Because some of them could be a little maroon color. So just bright red blood. And then of course, there are other conditions like allergic conditions, like you see in very young kids, milk protein allergy in the young children, and there's something called eosinophilic gastrointestinal disorder you can see in older children or adults, can also cause that. You can see blood in the stool. There's a condition called intussusception. Intussusception is a serious condition in which part of the intestines slides into the adjacent part of the intestine. It's like telescoping of the bowel.
So the bowel slides into each other like a telescope.
Exactly. And usually, and it causes, causes a blockage. Usually there's always a lead point, like maybe someone has a polyp, and that could be the lead point for that telescoping occurring. And when you have that, it can cut off the blood supply to the intestine. That's an emergency, so, the person will present with really severe abdominal pain in addition to the blood in the stool. Obviously, the person needs to go immediately to the emergency room.
And then to surgery, right?
And of course to surgery, yes. Although sometimes, in some cases, if it presents very early, there's an X-ray test where they can reduce that with something called a barium enema and just put in some contrast into the colon and kind of help and untangle it. Wow. If you want to say that. Yes. Wow. And then the other conditions like necrotizing enterocolitis, usually that is in very premature babies that we see, and that also is life-threatening. And then of course the vascular malformation, which is not very common, which abnormal clots of blood vessels that usually occur just prior to birth. So those are usual causes that can cause rectal bleeding.
So what would you say is the commonest cause of lower GI bleeding?
So the most common cause is usually like anal fissure hemorrhoids, So that's why you also ask about the stool consistency. So that's most common, especially someone who is well appearing and not having any other issues, no belly pain, no, no weight loss, none of those worrisome symptoms or what we call red flags. You ask for those red flags, weight loss, dizziness or any other thing. They don't have any of those, just present. And most of them will present like, okay, I have pain when I go to the bathroom and my rectum, or after I stool, it's when I see the blood on the tissue when I wipe. So more than likely it's coming from the anus, So that's one important history you want to take from your patient.